speaking now with Mike Danfulness, who is the former and past president of the Florida Senate and works very closely with Governor Rick Scott. In fact, I understand that over the past few days you've been answering a lot of questions about doctors and their interaction with the governor and what the future may hold. And I'm going to ask you, what does the future hold for the clients of doctors, and what do you think the governor is going to be doing in those areas?
Well, first, I think doctors are overjoyed with the result from Tuesday night. They're very concerned that Charlie Crist will take a further direction towards big managed health care, and I think they're concerned about that. I think with Rick Scott, a person who understands the medical business from his prior life, prior to politics, is a person who's looking for more flexibility, making sure that doctors make medical decisions and not the federal government. I think that's the main focus they had, and that's why the Florida Medical Association was so supportive of Rick Scott, and now the supermajority in both the House and Senate here in Florida.
Okay, so over the next 4 years, Governor Scott is in office here. Do you see us actually trying to separate or get a little further away from government involvement in medicine?
I think so. Florida's one of the states that said no to what we call Obamacare. They did not want to expand Medicaid roles as the current President Barack Obama wanted to do. I think what you'll see over the next couple of years is that they're going to look towards more flexibility. That means block grants for states, giving them the flexibility to engineer a medical system that works best for the patient as opposed to being a top-down solution out of Washington, D.C.
Is the emphasis going to be on the patient? I think that's a big question.
Well, it has to be. I mean, when you don't focus in that direction, you're going to have low-quality health care. You're going to lose the system. You're going to become Canada Part 2, and no one wants that, let alone Cuba. I think that people are looking for maybe more empowerment for the patient. I think one way that a lot of people are talking about, it's called health savings accounts. That means that the patient will decide how to use their dollars as opposed to having to go through a typical insurance company. And so I think you'll see the Republican Congress push towards HSAs or health savings accounts, and that truly empowers the patient.
Okay, and you touched on I think a real sensitive subject, and that is costs. I mean, the cost for the doctor to be in business is astronomical nowadays. I mean, with insurances and things like that. Do you see any relief coming that way and help for the clients?
Well, there's no doubt about it. And one of the reasons I'm here, of course, is my wife is the head of the Brevard County Medical Society, and she's been really an advocate for doctors. And one thing that we've worked over the last few years is tort reform. As you know, one of the big costs for all doctors is the high cost of legal protection. And so by having those tort reform measures put in place over the last 8 to 10 years in Florida, at least one of the costs that could go up so dramatically has been held in check, and that's been one look. And the other thing, again, is to give doctors the flexibility so they're not limited to what Medicaid reimburses or Medicare reimburses. They want to have that more flexible system, and I think by moving away from Obamacare, they'll do exactly that.
Can I summarize and say you're hopeful?
We're always hopeful, and I think a new president might help a bit in 2 years. But for now, I think what's important is at least there's not going to be an expansion that will further undercut the power of doctors to deal directly with their patients. So I think patient-centered healthcare works best, and I think that's the goal of the administration currently in Florida.
Probably the easiest person on the planet to interview is Dr. Bellani, because Dr. Bellani has been former president of the Brevard County Medical Society. He's been involved with local hospitals, but he's also got a big passion. It's called the Doctors Goodwill Foundation. And you've got some things that you're excited about. It's the thing you started. Tell me all about it. Tell me about what's making that smile on your face.
Okay. I'm Dr. Bellani, very excited about Doctors Goodwill Foundation. We've been in existence for last 11 years, and also we are very happy that we keep in our mind patient first. We want to help the patients, and also we want to help the health education so that the next 20 years the job security is in healthcare field, and also helping the local community by working with Brevard County Medical Society and other organizations to see how we can help students as well as the patient.
Right. In fact, the Goodwill Foundation has given a lot of money to college students to go into the medical field, right?
Yes. Doctors Goodwill Foundation had taken the challenge for UCF Medical School when they wanted to have first 40 students completely free. Doctors Goodwill Foundation with the Parish Medical Center, we gave $160,000 in 4 years scholarships to the first batch of medical students, and we have given almost like $400,000 in local scholarships for nurses, pharmacists, medical students, as well as all other healthcare related people.
Sure. So you're very encouraged with the way things are going, or the direction that things are going, and hopeful that everything will work out very well.
Yes, I think we are growing leaps and bounds, and we are also getting a lot of sponsorship and local community support, and also local leaders. And we are very proud to work with Space Coast Medicine magazine, which has also given an excellent platform to be known in the community where we are working.
Now, there's been a lot of medical scares in the news recently. Do you think the real underlying solution here is education?
I think the most common, what I feel comfortable is educating the patient, especially for chronic disease like hypertension, diabetes, and even like the latest scare, which was Ebola. If people know what they should expect and what they are going to come through, then they will be very, that reduces their anxiety, and this is what we can help them.
So get the facts, not the rumor.
Yes, get the facts, get the reality, and help yourself, and we can help you also, to the people also.
My pleasure to introduce Paul Yates, who is Director of Infection Control at Health First. And Paul, I would imagine you've been getting a lot of questions recently with the recent scare about Ebola. In fact, that's one of the topics that you're going to be addressing.
Yes, Dan, and we have. We've been very busy. We've been talking to folks. We've been doing our best to prepare for a potential Ebola patient. We've taken a lot of initiatives throughout Health First to prepare to care for a patient like that, and to protect our nurses, doctors, and others that might come into contact with a patient.
So it's actually prepare, practice, apply,
Yes.
and all this, and so you have to kind of do it redundantly, because I mean, even a basketball player has to go out and practice.
That's it. That's key to this, caring for, putting on this level of protective equipment. The key is practicing it. You get much better at it. You learn how to put it on, and more importantly, you learn how to take it off when it's potentially contaminated. You learn how to take it off safely, and that's the most important part about it, that you don't contaminate yourself as you're taking it off.
In educating the public, what are some of the things that you try to do to make sure that the public is, first of all, cautious but not scared to death?
Right. We try to talk to the public. We've put a lot of information out on our internet site as well as our internal website. We've issued some press releases. We just try to encourage people to think practically about this. It's a low risk. Would be a serious event if it did happen, but it's low risk, and so we have to put this in perspective. In terms of, like, for right now, this is flu season.
Right.
There's a much higher risk. Let's all go out and get our flu vaccine and protect ourselves from that, and think practically about Ebola, low risk.
Yeah, let me put it in perspective. How many people are going to get in a car, and how many deaths do we have in cars every year? And how many deaths have we had from Ebola in the United States? One?
One, yes,
One.
Exactly. So the risk is there, but we have to be reasonable about it. We have to prepare for it, because if we do have a patient like that, caring for that patient is very difficult. And we have to protect ourselves while we're caring for that patient, as well as give that patient the best possible care we can.
And do you like the idea, wash your hands?
I think that's a very important part of it, yes. Wash your hands and cover your cough.